more than once. I've seen it many times in my practice. And in fact, I didn't know it at the time, but looking back, my mother had this symptom before she had her problems with cardiovascular disease.
Hello, everyone, and welcome to the Evolving Ageless podcast. This is the enlightened woman's antidote to aging. I am your host, Michelle Dreilich. We've met before, and I am on a mission to change the way women age. Each week, I'm going to be joined by experts in their field that are bringing us the latest and greatest research so that we can live ageless. All right, so my guest today is Dr. Gina Pritchard. I'm so excited for you to meet her. She was a key faculty member in the Ageless Transformations program. And so you'll see her throughout the entire program guiding and offering her expertise. So she's a wonderful, wonderful asset to that program. And the reason why she's a part of that program is because of her background. So Dr. Gina is an acute care nurse practitioner. She worked in the cath lab for years, but she is now an expert in cardiovascular disease prevention. Okay. She is the owner of the Prevent Clinic. It's a clinic in Texas, and she's got offices in New York, and it's a virtual clinic as well, so that anyone can have access to her and her knowledge and her expertise. She's amazing. Okay, she's also the clinical director of what is called the BaleDoneen Method program. So the BaleDoneen Method is one of the world's leading programs for training practitioners, doctors, nurse practitioners, on how to, especially dentists even, how to reverse cardiovascular disease. So not only does Dr. Gina deal with the prevention of cardiovascular disease and the treatment of it, but I will tell you this, she deals, no joke, in the reversal of it. And so we'll talk a lot about that today. I'm really excited to have her on. And so I just want to say, welcome, Gina. It's so nice to meet you. We'll see you.
Thank you so much, Michelle. I'm thrilled to be here. I'm thrilled and honored to be a part of the Ageless program. You've put together a fantastic, life-saving, life-improving program with Ageless Transformations and Ageless LX. And thank you for having me today. Thrilled to be here.
So like I said, Gina and we have known each other for a few years, and I will tell you, when it comes to cardiovascular health, she is my go-to. And so the reason why I wanted to have her on today is because I'm wearing my red, because we're just on the tail end of Heart Health Month, right? And the Red Dress Society, and the whole idea of bringing awareness to women and cardiovascular disease. And so the reason why I want to bring that to light right now is because I read through literature all the time. I always want to make sure that we're staying current and bringing really great experts to help us along the way, right? And so I was reading this article about women and cardiovascular disease, and I just want to share a couple things, Dr. Gina, and then I want you to chime in and let me know why this is happening, okay? I read this and it stunned me. So we all know, believe it or not, cardiovascular disease and heart attacks and stroke are the #1 killers in America. Okay? They rank above accidents, they rank above cancer. They are the leading cause of death in America. So get this. This stunned me. More women die of heart attacks and strokes than men. Can you believe that? We don't ever think of it that way. At least I never have. What's fascinating is that last year, 300,000 women lost their lives to heart attack and stroke, which to me seems outrageous. And it's hard to compare what that really means, right? So when you think about breast cancer, sadly, we lose 40,000 women each year to breast cancer. 40,000. We lose 300,000 to heart attack and stroke. This is an epidemic for women. This is something we really, really need to learn about, right, Dr. Gina? And it's different in women, right?
Yes.
So let me ask you this. I read that doctors miss very often in women, they miss that women are having a heart attack when they present in the ER.
Oh, Michelle, that information is accurate and so, so sad. But all of us who've been practicing with this type of preventive healthcare and preventive medicine and anti-aging medicine for any length of time sees one or many more women who have gone to their doctor, gone to the urgent care clinic, gone to the ER with symptoms and dismissed as cardiac, didn't even have a thorough workup for a possible cardiac related issue, and much more so than men. And so it's very, very sad. And of course, we're all trying to re-educate the medical community, the healthcare community that are practicing in a conventional mode or a preventive mode. But I'll say that 1 in 3 women, for example, have high blood pressure and don't even know it. And across the board, it's a problem treating blood pressure to goal overall, men and women. But so many women either are dismissed, we don't know, or they're not checked, we don't know, or they have it and they just weren't told. I don't know. But either way, much more so than men. But when a person goes to the doctor or urgent care center with symptoms that you think of classic, like clutching of the chest or heaviness in the chest, right? An elephant sitting on my chest. That's what we often think about when we think about having a heart attack, or when we think about a stroke. One side goes numb, or maybe part of your lip starts to slur, or someone with you says, you're not making sense, you're starting to slur your words, maybe you don't even know it. And we can go into these symptoms or signs in great detail for sure. But I have to say, in women in particular, the symptoms are very different than men. Yes, they can have the classic, oh, I have crushing chest pain. But we know any female presenting with any complaints from the waist up, hyper alert, rule out cardiovascular disease first. Rule it out first. Men too, really. But men, again, tend to present with more classic symptoms. But women, it could be a feeling of numbness in an arm, particularly the left arm, or numbness even in her fingers. It could be shortness of breath, palpitations, dizziness, feeling lightheaded, or feeling like you're fainting, or a feeling of energy. Here's one I can tell you that is not commonly spoken about, and I've seen it more than once. I've seen it many times in my practice. And in fact, I didn't know it at the time, but looking back, my mother had this symptom before she had her problems with cardiovascular disease. And it is lack of energy, and your legs give out when you go, let's say, to the mall. I couldn't keep up with my mother at the mall. She loved shopping, and she would hit all the stores or all the ones on her list. And she started to say, I'm going to sit here on the bench and you go do whatever and come back. And, we just thought it was her age. But get checked for cardiovascular disease first with any of those symptoms. Press
Wow.
and go find another doctor till you can get checked.
That's right. What about heartburn? Is that one of them?
It is. I did not mention that one. Yes. Don't dismiss heartburn, particularly if you say, "Ooh, I never have heartburn several days in a row. Now I've had it several days in a row, and this used to work," whether it's, Tums or Nexium or whatever it is. It's not working anymore. Or if it's the worst heartburn you've ever had, I say run, don't walk to the urgent care center or to someone who's going to give you an appropriate evaluation. And don't take no for an answer. If you can't get the care you need there, go to the next place, particularly as a female.
And I think it's very often when a doctor says, well, this sounds like this or that or the other thing, we're almost afraid to speak up and say, do you think it could be my heart? Part of it is that we don't really want to know that. But the other part is most people don't know. I would never think that heartburn or shortness of breath, right, would be a sign that I could be having a heart attack. So absolutely, it's okay to ask. In fact, for women, like you say, waist up, if you're going into a doctor urgent care because you've got a symptom, ask, because 53% of the time, doctors miss the signs in women. 53%, which is why more women, wouldn't you say, are dying than men, because men have that crushing feeling and they get a workup right away.
Yes, absolutely. I would say that's one of the key reasons why. And the second key reason is that heart attack specifically occurs in women the statistics vary, but somewhere between 8 to 12 years later across the board than men. So men are more likely to have their first heart attack, unfortunately, at age 55, let's say, and women more so at 65. So even if your doctor's thinking, yeah, we need to do a workup on this female sitting in front of me, they think, well, we have time, she's still 45 or she's still 55 or whatever they're thinking, right? So that's two reasons that women die at a more rapid rate, at a higher incidence than men. Later onset, or later, at least later onset that it's found, and later on not getting the appropriate workup, a thorough workup.
Wow. So then, okay, so we talked about some of the risk factors, or we've started to. So you mentioned hypertension, but we can, 1 in 3 women have high blood pressure and don't know it, which is fascinating because our blood pressure is measured whenever we go to see our clinician, right? Our provider. However, very often this white coat syndrome, right, where people get nervous, so their blood pressure goes up when they're at the doctor, sometimes it gets dismissed. That is a possibility. So that's why it's always good maybe to have your own blood pressure cuff at home. I know we have one for sure, just to track it every now and then.
Yes, for sure. And I would say, in addition to that, we need to let go of that myth of white coat syndrome. And I'll tell you why. Studies have come out demonstrating the fact that if your blood pressure's up because you're a little nervous or just because it's a little different that you're in the doctor's office versus, sitting in the spa or something, then think what your blood pressure is when you're running because you're late for a meeting, or when you're in traffic and you can't get where you need to go, or you're frustrated over anything. Probably your blood pressure is as high or higher there as it is when you have, quote, white coat syndrome in the doctor's office. So we need to dispel that myth. If your blood pressure is above 120/80, keep checking it and don't accept that. Get it down. And that's another topic, right, for another day, is how to treat high blood pressure. But if it's above 120/80 consistently, it's too high.
Even if it's when you're nervous or when you're in a hurry or stressed, because we tend to all live in a hurried, stressed world, right? So that just means that your blood pressure is probably that high more frequently than you think.
That's right. That's exactly right. So check it at times of rest and calmness, and times of anxiety, or times of rushing and that kind of thing, to see even what your trends are, what your average is, that kind of thing. And you'll learn a lot more about yourself and understand if you need to be treated or not. And especially since we're talking about reversing aging, keeping your blood pressure below even 118 is better than 120 on the top. Many times over and over in numerous studies, it's been associated with improved longevity and improved cognitive function to the last year. So got to get that blood pressure down.
Wow. I didn't even know. I've never heard of it relating to cognition. That's great. So, we are always, brain fog is a common complaint of women for many reasons: hormones, thyroid hormone, sex hormones. But cognitive decline is a very real thing we need to stay on top of. So it could be that it's related to hypertension for you. So what are some of the other risk factors?
So we all know cholesterol is a risk factor, right? But it's, certain nuances of your cholesterol. It's not just the total cholesterol. That's another myth. But getting an in-depth lipid profile, getting some of the smaller particles, particularly probably because Bob Harper has made it well known in the news, lipoprotein A is a special cholesterol particle that needs to be tested for sure in all women, men too. But the one I really like to talk about, because most of us get our cholesterol profile or panel every year, just might need to add some things to that. But what most of us don't realize is the number 3 risk factor for men and women for heart attacks specifically. This is in a study, huge study with hundreds of thousands of people evaluated and all variables removed. The third cause of death of heart attack, or I'm sorry, not cause of death, but the cause of heart attack in men and women were psychosocial issues. And most of our doctors aren't even talking to us about that. What does that even mean? So anxiety and depression for sure, mental illness for sure, but it can also include 1 divorce. Certainly it's exacerbated by 2 divorces. It also includes being in a situation that you can't control. For example, if you're a female and you're in a job and you have to keep that job because your children are hungry or because you can't make, the bills if you don't keep it, and you're in an environment that isn't healthy for you, whether it's an overbearing boss or unreasonable deadlines, or perhaps it's a industry that you don't even feel like you belong in with integrity. Any of those things causes psychological stress. So it can be a social thing, relationships that are not good, lack of friendships, lack of joy in your social relationships, and it can be all the way up to depression and suicidal and anything in between. Frustration, anxiety, stress is not to be ignored. It's a killer.
It's interesting, and not to always compare it between men and women, but we've always associated type A personalities, right, with having, I mean, the research shows type A personalities suffer from heart attacks and strokes more often. And it could be lots of things that go into that, right? Because type A personalities have different lifestyles, they tend to have different ways of approaching problems. But we never think about the things like your family situation, your work situation, your how many friends, do you have a friend network? How much do you hold in and keep to yourself and struggle with? Um, and so it's just a call to action that whether it's anxiety, depression, isolation, just overwhelming sadness, maybe you don't want to call it depression, absolutely reach out to someone, right? Talk to someone, because it not only has implications for how you live your life, but it affects your health in so many ways.
Yes, absolutely. Those are
Yeah.
life-saving recommendations for sure. We tend to put
So while we're
everybody
talking
else
about
first.
women,
Yes.
oh
Yeah.
yes, women put yeah, that's right.
Right.
Once everyone else is taken care of, then we take the 5 minutes to try to take care of ourselves. And that I'm really proud. I think we're changing that. That's what this is all about. We're all evolving to be
Yes.
ageless. We're all recognizing these traits that we have. Um, and giving 150% to everything else in our lives, and ignoring the self-care aspect. And so
Yeah.
that's what this is about, is self-care. So we're talking about women. So let's talk about, I know estrogen plays a role too. So in terms of risk factors, we've talked about high blood pressure, hypertension, we talked about
Yes.
psychosocial issues. Tell us about estrogen.
Yes. So, estrogen and hormones in general are a topic that almost has an inroad into everything else that leads to cardiovascular disease, because hormones, female hormones, estrogen and progesterone and testosterone, the balance and the health in those, in your hormonal makeup, regardless of your age, plays a key role in thyroid health, adrenal health, putting on muscle, keeping off the fat, dealing with stress, like we've just talked about. And so, estrogen, also low estrogen, is associated with the onset of diabetes. We know it is associated with cardiovascular disease. And so, cannot ignore premenopause, menopause, postmenopausal women by just saying, I don't do, as a healthcare provider, for example, if someone says, I don't do hormone replacement therapy, then send them to someone that does, because maybe not everybody needs hormone replacement therapy, but you need and deserve to have your hormones evaluated. Let me give you another example. It's certainly more of a problem when a woman reaches 40, 50, 60 years of age. Young women are somewhat protected by having menstrual cycles, because you have a lower iron, lower ferritin by getting rid of that blood every month. That's an entirely a different topic as well, but again, hormone related. So we lose that protection when we stop having periods, besides the fact that our hormones are oftentimes in a wreck. And also young women, comparing to older women, young women that have PCOS, maybe many of the listeners have that or have heard about it, polycystic ovarian syndrome or polycystic ovarian disease. I say, and I'm not the only one, many of my colleagues say the same thing. Every young woman that comes into the clinic has polycystic ovarian disease until proven otherwise. We've historically thought it's been the female who's a little overweight and has a certain look, and we now know that's not the case. It's related to hormones, it's related to insulin and how estrogen and our hormones react with insulin. So it is a little bit of a complex issue. We don't want to delve into the science, but just to say once again, don't take no for an answer in terms of from young age all through the end of life. You want to be on top of your hormones because it will save you or it will cause you trouble in the world of cardiovascular disease.
So would you say, so you mentioned earlier that women present with heart attacks and strokes or suffer heart attacks and strokes later in life than men. Men usually 55, women usually 65 or higher. Is it because, is it largely driven by our loss of estrogen? I mean, is that a big part of it?
That's definitely a key component, but it's hard to pinpoint because one, again, they've maybe been ignored for many years and not had an adequate workup, right? Till they get classic, like, I don't know, I'm in the ER with a heart attack, let's say at 65. Well, we could have prevented that if we'd seen you at 55 and done an appropriate workup. So I think that's one thing. And then not even being on top of the risk factors, like doctors tend to be more with men, like the blood pressure that we talked about, losing a lot of those protective mechanisms that we have as a young female once we get older. But you can't ignore estrogen as playing a role in that as well. It does, no doubt about it.
And here's the tricky part, and we've all known this, and I will say personally, having seen patients for over a decade, when I had postmenopausal patients and they would tell me, I just can't lose weight, or I'm gaining weight and I'm having a difficult time controlling it, there was always a skeptical side of me, you know, as a clinician thinking, maybe you just don't understand portion control. And man, was karma bit me on that one. I absolutely noticed that as I started to turn the corner on menopause, I absolutely noticed a shift in my metabolism. And it's one that I understand and caused me to get a hormone workup right away, just because I knew that it's more than just maintaining the way I look. It's more about preventing disease in the future. So I think it's important, and I think it ties into the next risk factor, right, which is obesity. And it's not about, you know, everyone needs to lose weight or be the perfect slender thing, but we do know, right, that obesity is a major risk factor in cardiovascular heart attacks and stroke.
It is a major risk factor. And even being 10 pounds overweight over an ideal range for your age and gender, particularly for women, increases your likelihood of having high blood pressure. Gaining and losing 5 or 10 pounds can make a huge difference in your blood pressure for the moment, but also longevity and prevention of cardiovascular disease in the future. But obesity for sure plays a role in heart attack and stroke rate. But again, just as you've beautifully explained, Michelle, the obesity is tied into this insulin relationship with estrogen and our hormones, because can't tell you how many women I've seen that have described what you've just described, and they say, I'm eating the same way. In fact, I've cut back. I'm exercising more, and look what keeps happening. And part of the problem is without hormone balance, you cannot gain muscle. And we all know that we lose muscle as we age if we don't proactively, with intention, maintain it and build it. And so if we're not doing that, at the same time we're maximizing our hormone balance, then we are all headed for obesity or overweight for sure once we get to a certain age.
Yes. So, gosh, you touched on so much there. I love it. So you did touch a little bit on this idea of insulin, right? So when we talk about hormones, we always, I think, collectively think of sex hormones, estrogen, progesterone, testosterone. But remember, thyroid is a hormone, right? And insulin is a hormone. And so insulin is all part of our blood sugar metabolism. And so you're absolutely right when you say women over 50, as you start to see them year after year, they start eating like birds. They start eating such small portions of food because of weight gain. But what's happening is insulin is typically a culprit in this, right? So let's talk, because I know diabetes and pre-diabetes is a risk factor. And I know that it's important that everyone understand how or why it's important to know.
Yes, absolutely. How or why insulin, where you stand in terms of insulin resistance and diabetes?
Yeah, right, right.
Absolutely. So most of us are used to getting our fasting blood sugar every year on our annual exam. And do you know that your body can maintain a normal fasting blood sugar for many, many years while you're well on your way towards diabetes? That's not a good test to determine if you have diabetes or not, if you have insulin resistance or not, if you have prediabetes or not, and even if you're headed towards diabetes, because it's one of the last things to get our attention. More and more doctors now are at least offering a hemoglobin A1C, which, as you know, is a 3-month average of blood sugar overall. So I would say if your fasting blood sugar is above 120, absolutely you're in trouble. And if your hemoglobin A1C is positive, for sure above 6, above 5.8, above 5.6, all of that should get your attention. If you're 5.5, 5.4, 4 is fabulous. You want your hemoglobin A1C to be low, but don't stop there. Don't put all of your peace of mind in hemoglobin A1C of 5.2, let's say. If it's positive, either one of those, then get further evaluation. But if it's normal, then you need to ask your doctor to get more tests and understand exactly if your insulin and glucose and hormone interplay, if your metabolism of glucose is healthy, or if you're starting to head down that track towards diabetes. We can know that now with the current science technology tests that we have available. It's relatively easy to figure that out.
It's always blown my mind that when we're checking blood sugar, blood glucose, we're looking for diabetes or pre-diabetes, yet it's so rare to find a clinician that's checking insulin, fasting insulin, which is what the culprit is. It's not the blood sugar, it's the insulin issue as well, right? They work together. And so insulin's always a good idea to ask your doctor if they're going to run those tests anyway. Why not ask to toss in a fasting insulin along with your hemoglobin A1C and your glucose? Because insulin is such an important hormone to take a look at.
Yes, absolutely. That's such a good point, Michelle. And back to talking about those individuals with polycystic ovarian disease or polycystic
Mhm.
ovarian syndrome, we know that that's a problem with insulin. That's why you have polycystic ovarian syndrome, or it's a vicious cycle. You have insulin resistance or prediabetes because of the PCOS. You have PCOS because it's a syndrome, right? But what's
Mhm.
interesting, we know that that's the case because brothers of females with polycystic ovarian syndrome oftentimes have insulin resistance. They have a high incidence of insulin resistance. So there's a genetic component, and that also is tied in with how we metabolize and how we keep our hormones balanced, genetic related. So anyway, if you're a female and you have PCOS, you definitely need a deeper dive into where you stand in terms of prediabetes or insulin resistance, and you should tell your brothers to get checked.
Oh, I love that. There's one last risk factor, which is, I think we'll talk on it briefly because it's one that stands to, it doesn't need much discussion, but smoking, right? Smoking is a
Right.
huge risk factor for women, especially for cardiovascular disease, heart attacks, and strokes, right?
Right, it is. And a couple of things that I'll say about smoking is it isn't just smoking cigarettes, it is secondhand smoke. It is smoking of any kind, fill in the blank, whatever an individual is smoking, whether it's marijuana or vaping, and it's air pollution. So just really think of smoking of anything except fresh air with great amounts of oxygen in it should not be going into my lungs, whether it's because someone next to me is puffing on a cigarette or because I'm in an area where there's terrible air pollution. We have to protect our lungs because that gets into our system and it damages the arteries and puts us at risk for heart attack and stroke. No doubt about it.
And I've read another fact that kind of falls into this whole category of how women are different, right? Women have a much more difficult time quitting smoking than men.
Yes, that's true.
Isn't that
And
interesting?
very interesting and sad, right? Very sad.
Right. And so many ways that for women there are aspects of our health that are affected by what we do, and then there are just aspects of our health that are affected by the fact that we're women. And
Mhm.
so if you do smoke, absolutely, we're past the point where our ancestors, our grandparents, they had a feeling it wasn't too good, but they didn't know. We didn't have the hard evidence that we have now that even starting smoking is such a dangerous path, or even working, if you're working in an environment where you're exposed to secondhand smoke on a regular basis and you're getting older, gosh, it's time to maybe look for something else to do.
Yes, absolutely. And
Mhm.
an interesting fact that's tied to that and tied to this terrible statistic that more women than men die of heart attack is the fact that as women, we tend to be smaller overall, right, compared to men on average. Well, the female heart arteries, which are the blood vessels in the heart that give the life-saving nourishment to the heart muscle. If you have a heart attack, it's because you have a problem in one of your heart arteries. So these are very tiny little blood vessels to begin with. Some of them as small as the size of
Hair.
a hair. Yeah,
Mm.
exactly. And so when they're smaller to begin with, guess what smoking does? It causes those arteries in men and women to constrict. And we already have smaller arteries to begin with. So that's one reason women, even more so than men, have a problem with smoking or potential
Mm.
death from smoking. And also because of this fact that it relates to the fact that more women are dying at first heart attack at an older age, because if you have smaller arteries, there is less that we can do for you when you come to the hospital. In other words, if somebody has a large arterial system, nice large plump blood vessels, then we can put a stent in there, we can perform bypass surgery and save them from hopefully dying and from having a terrible quality of life. But if they're small to begin with, like most women are, and if you're a female and a smoker, your heart arteries look terrible when we look in the cardiac catheterization laboratory in the cath lab. We don't have much to work with. So I just throw that out there as more motivation to find a way to quit and to get away from that
I
secondhand smoke.
love that. That's great. All right, so let's shift away from risk factors. I think we've covered some, these are the major ones. This is not the last time you're gonna see Dr. Gina. Whenever we get together, we talk forever. So, but we've got so many different things to share and to provide education on. And so we'll continue this series. But for now, I wanna leave, let's talk about what can women do? What can we be doing? So other than working on our risk factors, what kinds of tests, what are like your top tests that we should be asking our clinicians for, or at least knowing this about ourselves?
Yes. So I would say let's go over the ones that we've hinted at up to now. One is don't settle for anything less than a blood pressure of 120/80. Get a blood pressure cuff in your home and keep an eye on your blood pressure. The second is ask your doctor to get more than the fasting blood sugar, just like we spoke about. At least a hemoglobin A1C, at least a fasting blood sugar. And guess what? A good old-fashioned 2-hour glucose tolerance test, like many of us had when we were pregnant, is a great test to help us get more clues about whether you're headed for diabetes or not. So that's another test to ask your doctor about. And a topic for another day is the fact that you can also get, and I recommend for all my patients and all my followers, to get a finger stick blood sugar monitor and bring it into your home, because then you can check it yourself and see what happens after you eat that piece of cake, or see what happens. So topic for another day, but keep an eye on your insulin resistance, pre-diabetes blood sugar in that way. The other thing I would say is to also get an evaluation of your arteries. We haven't talked about this yet, but I'd just like to briefly bring up the fact that very early in life, I say that because I'm in my late 50s. So very early in life, we used to say it was 45 for men and women to get an evaluation of their arteries. Now we say, wow, it's way too late by 45. At 35, doesn't hurt at 25. All of us should have what's called a computed tomography, a CT, coronary artery calcium score. You go to the radiology center, it's getting less expensive every day. Most centers charge $100 or less. A test that used to be thousands of dollars years ago keeps coming down in price. It's readily available. And that information will arm you with, do I have vascular disease today, whether I'm 25 or I'm 85 or I'm 105? do I have vascular disease today? So it gives you something at baseline to be able to look on the inside and know that you're reversing the aging process by tracking that over the years. I would
Oh,
definitely
I
give
love
that.
it. You said it. You said reverse it, which is great. So
Yes,
to start with one, if you've never had one of these, a coronary calcium score, ask your doctor. As
yes,
Dr. Gina said, they're inexpensive, relatively speaking, for the amount of information that you get about yourself. And I can tell you, a heart attack or a stroke are a lot more expensive than a test that runs probably between $50 and $100 at your local hospital. Um, but I think, okay, so the fascinating thing about knowing this about yourself is that it's actionable information. And the good news is it doesn't mean that's it, right? So
right,
you get a calcium score, and even if it indicates that you have cardiovascular disease, what can you do, right? It can be
right,
reversed. It's
right. So
never too late.
never too late. Then you can see a prevention specialist if you're not getting the answers you need from your primary care doctor or your cardiologist or whoever you're going to with this information. If you're not getting the answers that you need, then seek out a prevention specialist for sure, because there are more and more of us every year. And you need somebody that's going to take a deep dive, a close look at reversing that process, because you have to in order to extend your life and be vibrant to the last breath.
Absolutely. And it blew my mind. You told me this, gosh, probably a year ago, maybe a little more, which was anyone who's already had a heart attack or a stroke has a 50% chance of having another one in how much? How many years?
Yes, in the next two to
Within
five years,
2 to
depending on,
5 years.
yeah,
Yeah.
depending on the
That's a
nuances of
coin
the heart.
toss.
Exactly.
That's
And
the
so we,
scary part. It's a coin toss if you're not working with a prevention specialist, because your doctor can still prescribe medications. It's not like it will look like they're doing nothing, but unless you're working with someone that's tracking how your arteries are improving, you're not working with a prevention specialist, right?
that's it. We have to track, are the arteries getting healthier this year as compared to last year? Just like we'd get a mammogram maybe every year, every 2 years, whatever. We're not here to debate the benefits of mammography, but any test you get yearly, get some sort of test to look at the artery health to make sure you're better this year, or at least no worse this year than last year. That's how we track reversing not only the aging process, but reversing vascular disease. And
Mhm.
also think about it, Michelle, if we see someone who's had their first heart attack, who's gotten that statistic and said, wow, I've got to do something because I'm at risk to have another one in the next few years. Great. We love it. We can stop, halt the disease, reverse the disease process even then, even after you've had a cardiovascular event or a problem. But think about it. Women that are presenting with that problem are 10 years older than men in most cases, right? So they're presenting with this first heart attack at age 75 or 65 as opposed to 55 or 45 like most men. And so again, the reason that the mortality rate, the death rate is so high, unbelievably high among females. So we've got to get this life-saving message out.
I love it. We could talk all day. I have 6 more questions in my head, but I think this is a perfect place to end this conversation, because we are going to continue on with this series of cardiovascular health and answer any questions folks have. When you go to evolvingageless.com, you'll see the show notes in there. You'll see information about Dr. Gina, the tests that she talks about, and links to some of the research articles that we're talking about as well, so that you can either take that information into your own practitioner or read it for yourself, so that you understand how to take control of your own health destiny, right? We own our own health and are responsible for that. And so the whole purpose of Evolving Ageless is that we're on a mission, right? We can change the way we age with a little bit of information and a whole lot of motivation and simple changes in our lives. So I just want to thank you, Dr. Gina, so much for being here today. I love you. You have so much information, your energy that you bring. You're just such a wonderful person, making such a big difference in the world.
Oh, thank you so much, Michelle. And I do hope that the listeners will put in all of their questions, because we do have a lot of a lot of literature, a lot of topics. We have many things we want to talk about in upcoming episodes, but most of all, we want to know, what do you want to hear about as the listeners, our female friends out there? So let us know what questions you have. I can't wait to address them on future episodes. And Michelle, thank you so much for having me and for all that you're doing for women and across the United States and across the world.
Thank you so much, Gina. All right, everyone, that's it for now. Again, visit evolvingageless.com, check out the show notes, leave us a comment. We'd love to know what you want to know. All right, take care. Have a wonderful day and keep on living ageless.